Okay, Philip, we are live on Facebook. Now, this does have a bit of a delay, so we'll just give it a minute for it to be streaming okay onto Facebook. I've got another screen over here, so I should be able to see in a moment, but that's all okay. And I think really I do need to start by telling everyone what I've just told you, don't I, Philip, which is that I've really hurt my back doing the hoovering, no less. So if you see me sort of going, or anything like this, it's just a spasm in my back. I am waiting for the Nurofen to kick in and hopefully it kicks in soon. So yes, if you see anything funny from myself, that's what's happening. So I'm just checking. Yeah, that's all nice and live. Brilliant. Okay, so, oh my gosh, I'm so excited about this. Philip, I first met you so many years ago through the Mouth Cancer Foundation. You're a regular on the lecturing circuit for the Mouth Cancer Foundation. You've been a huge ambassador for them for so many years, and you've educated so many of us, you know, in the dental profession, not just dentists, but as DCPs as well. You've really educated us to a very high level and brought mouth cancer awareness to the forefront of what everyone's doing in practice. So I just want to firstly thank you for that.
Thank you very much. Very kind words.
Oh, well, no, that's absolutely the truth. And you know, your lovely daughter Chloe, she's been highly involved as well. She's followed through and really supported you with that, and I know she still does as well. So hi, Chloe. So yes, so Dr. Lewis, everybody. Now this is Philip's first live. So again, thank you for stepping out of what might be your comfort zone this evening to have this live conversation with me.
Well, I'm delighted to try. I'm worried, obviously, I'm going to just talk a load of rubbish, but most people say I talk a load of rubbish all the time in any case, so nobody will notice.
I'm sure that's what your wife says and what Chloe says. I'm sure that's...
I cannot answer that question on the ground.
I know what I'd say about my dad, so yeah, but we'll leave that there. So why are we holding this tonight then? Let's just confirm why we are here live on Facebook on a Tuesday evening, and thank you everyone who's watching live. And I know these Facebook Lives, so many people watch afterwards as well, so thank you for anyone who's watching afterwards. I'd really like to start by saying if you have any questions, then please do pop them into the comments. I will go through the comments and I'll read them out, and Dr. Lewis will answer those for you. But there's a couple of reasons why we're doing this tonight. You should hopefully know that we are approaching the time of year where the mouth cancer awareness events are in the planning in your practice. Hopefully they are. Now this year, quite a few things might have got in the way, and we really want to bring the planning for Mouth Cancer Awareness Month to the forefront of one of your many busy agendas in practice, and really share with you tonight ways that everybody can get involved in the practice, particularly the team as well. And for me, I just feel that the Mouth Cancer Awareness Month and the walk that we're going to talk about and how that's changing this year, that really gives practices something very positive to communicate out to patients in their newsletters, on their social media. Practices, social media channels at the moment are full of PPE pictures and things like that. So I think it's really nice to have something positive. I know from my clients, dentists are tired, everyone in the team's tired, the nurses are struggling, the front desk are getting a battering from patients left, right and centre. So this, for me, this is something really positive. And if you know me, then you know that's what I'm about, trying to find things that are really positive in life to really give us something great to focus on. So that's my angle, that's why we're doing this. And of course we do want to raise awareness and really recap on the importance of raising awareness around mouth cancer, particularly at the time when we know that the amount of patients that are having routine examinations is really at probably the lowest level it's ever been, due to restrictions in whatever part of the country you're in, whether you're NHS or private, whether it's an occupancy or capacity reason. And the number of patients having mouth cancer screenings really has dropped, and it will be at the lowest level probably ever at the moment, which is a worry, isn't it? So yeah, so that's why we're here tonight. Anything you want to add to that, Philip?
Yeah, really just to amplify what you were saying, that the access to dentistry, particularly to examination appointments, well, it's never been like this before. We're hearing stories that half of the children in this country have missed appointments because of COVID. And as the pandemic continues, dental practices, which, as you know, are under a whole lot of new restrictions, are short of time, are prioritizing emergency patients, and at the expense of the general routine examinations. And I don't even like that term, general routine examination, because our general routine examination can save someone's life. And unless we see patients, we're going to have a lot of difficulty diagnosing mouth cancer. Now, there are other ways that we can go about it, and we'll be coming on to those later. Particularly, I'd like to say a bit about self-examination and things that people can do at home. But a professional consultation is still very, very important. And really, we don't see that coming back anytime soon. Until dentistry is back to normal, then these examinations are not going to come back to normal either. But as I just said, I think that could be a very long time. And that's one of the main challenges we've got at the moment. Lack of access, patients not being able to see the dentist, and still a sizable number of patients who don't want to visit a dental surgery or a doctor's practice or whatever because of their perceived fear of being exposed to the virus. And again, one of the things that I'm always really trying to impress upon people nowadays is that the measures that we have taken, particularly in the dental profession, to keep people safe, makes our practices very safe places to visit. So people should not be put off on that score if they've got an opportunity to come.
Yeah, absolutely. And just to sort of back up what you're saying, my mum, who is in her mid-60s, I'll say, just in case she listens back to this and gets annoyed with me, and she's one of the fearful people. She doesn't really want to be going out and about. We definitely haven't had any lunch dates, myself and my mum, which is something that I really miss. But she's been to a few places now, and she's been to the dentist, the beauticians and the hairdressers. And the place that she felt the safest was the dentist.
Yeah, well, that's wonderful.
Everything was fantastic. And my mum was a nurse, and my mum has a clinical background. She understands clinical aspects, and she said it was just so safe and so comforting and so reassuring in that practice. And that's a big practice that she goes to as well.
Yeah.
So the more people that we can get back into practice who are delivering messages like my mum is, it's fantastic. I've just, picked up on something that you've said as well there, Philip, that when my back's going, if I do that, that's my back. When practices have been classifying treatment, you're absolutely spot on, aren't you? Because we've been classifying treatment as urgent, essential. Now, the hygienist appointments, gum care has fallen into essential, and hopefully hygienists are doing the full mouth cancer screens. Hopefully that's one box ticked. But yes, you're absolutely right, aren't you? That examinations have been popped into routine care, have been put on the back burner as such, yet they are a life-saving appointment.
Yes, they are potentially. And of course, we can't say how many people have missed a diagnosis because of COVID, because you can't prove a negative. We don't know what we don't know. But what we do know is that the hospitals are reporting a lot of late detection coming in now. And certainly people who might well have been examined and detected earlier are now reaching a later stage of the disease before they're seeking treatment because they haven't had the opportunity to be examined. So I do think this problem of access is a really serious problem. And just getting back to you now, leaving mouth cancer for a moment, I say to every new patient really that I see, I take more teeth out because of gum disease than any other reason. And we all know that the implications that gum disease can have on general health, on heart health, on the cardiovascular system, on just about everything. And yet, hygienist services are only just beginning to come back. So why? Because that's an unnecessary, routine procedure? I don't think so. I think we as a profession really do have to look at what we're doing, why we're doing, and the consequences of not doing things.
Yeah, absolutely. So can I ask you then, in regards to the reports in the media about the low detection rates of mouth cancer, that due to access, it is now a problem. How true are those reports in the media?
Well, as I just said, we can't give a figure, a number of people who haven't been diagnosed because they haven't been diagnosed yet. And so it's impossible to say. You could certainly speculate that there are a lot of people out there right now who are suffering with mouth cancer and have not been diagnosed because they haven't been able to see a dental professional. But it is only speculation. That is something we can't prove, but it seems to stand up to common sense. But as I just said before, what we can prove is that more late diagnoses are coming in. And of course, the key to the treatment of mouth cancer is early detection, because the later the disease is discovered, the more aggressive the treatments that are needed, and sadly, the worse the chances of surviving the disease.
Yeah, okay. That's a real shame, isn't it? That it is the late detection. And you just made me think of patients during an examination many years ago, and I just knew something was wrong. The dentist who I'd worked with for a long time, he went very silent. He said, "Have you noticed this lump in your mouth? Have you noticed this?" And the patient said, "No." And he said, "I'm just going to get a colleague." And I knew something was, it wasn't a normal examination, as it were. And he went to get one of the other partners and their body language and everything. And this gentleman had a huge lump on the inside of the roof of his mouth, and he hadn't even noticed it. And he was sent on the urgent pathway, and it was mouth cancer, and it was at quite a late stage. And I think back to that, you just made me think of that people aren't necessarily even aware.
No,
there's a concern in their mouth because they're just used to that change happening. We get used to changes happening to us, don't we, if we're not aware?
Yeah, absolutely. And again, the statistics are something like 88% of people have heard of mouth cancer. And don't laugh, because that's good. That's gone up by about 45% in the last few years. A few years ago, people didn't even realize you could get cancer in your mouth. But now 4 out of 5 people do know it. But only a fraction of those could tell you what the symptoms are. And as we all know, well, an ulcer's an ulcer, isn't it? We all get mouth ulcers. And even a swelling, I must have bitten myself, or, something's happened. People, this is where raising awareness of the disease at all levels is so important. And one very simple way of raising awareness, and hey guys, I'm saying it to you dental professionals out there, I know that now almost everyone is carrying out regular thorough mouth cancer examinations. Please tell the patient you're doing it, because again, the statistic is only about 17% of patients realize they've had an examination for the early detection of mouth cancer. And that's because we as dentists and dental professionals have always been pretty poor at actually telling our patients what we're doing and why we're doing it. But by doing that, that in itself is raising awareness, making people interested, making them perhaps learn a bit more about this disease, which could protect them and everyone around them.
Yes, and when I'm working with dentists on their examination appointments, and I say, okay, so you must tell the patient exactly what you've just said. Oh gosh, oh no, I don't like to use the C word. Oh, you know, but you've got to do it. You've got to tell the patient. They've got to know, haven't they? It's absolutely key.
Yeah, and I mean, again, I am not a statistician and I'm not that good with numbers, but I do know as well that a bit of research which came out fairly recently said that well over 80% of people said they were comfortable about cancer being discussed during an examination.
Yeah.
I mean, there will always be some who say, no, I don't want to know about it. But that's their problem, not our problem. We've got to be supportive and sympathetic at all times.
Yeah.
But we do have to get this message across, or more people are going to die.
Absolutely. And then something that we're both very passionate about, and alongside with the Mouth Cancer Foundation, is actually taking that to a new level. And it's really prevalent to do that right now, which is what I want to talk to you about next, which is the self-screen, teaching patients to self-screen. We are taught to, as women, self-screen a certain area of our body. Men are taught to self-screen an area of their body. Yet there is something else. Doesn't matter what gender you are, we can all screen this area. So how would a dentist or hygienist, therapist go about the communication? How do they go about educating a patient on how to self-screen? What are your tips?
Right, well, a few months ago, we would have said, have a stack of leaflets available. But we can't do that anymore. But here's one I did earlier. Okay, this is the self-screening leaflet. There is no reason at all not to get a leaflet like this laminated and to actually show a patient what to do, and then say, and then when you get home, log into the Mouth Cancer Foundation, where it is in full detail, and you can download a leaflet of your own if you want to. So certainly from that point of view, we're limited on lots of information that we can pass out to our patients nowadays. But there are other ways of doing it. You don't have to have reams of paper in the practice. And again, the most important thing is awareness. So at every time that a mouth cancer examination is carried out, certainly if there's ever any doubt during a consultation, like we were just saying a minute ago, patient really does need to be told this is going on because, and don't worry, because you've almost certainly not got mouth cancer, but if there is the slightest risk, we want to be absolutely sure, you know, for your benefit, to eradicate any problems that might occur in the future. So tell patients, physically tell them when they're in the practice. A lot of us are sending out newsletters, information, communications and that sort of thing. Put it in there as well. Nothing to stop you at the foot of your email, putting in a link to the Mouth Cancer Foundation, for example, for more information, go here. There are all sorts of things that we can still do, even in these unusual times, to get the message across.
Absolutely. And again, I think this is something that could be really positive, Philip, that practices could put onto social media, and it could be the hygienist, therapists, or it could be the dentist. But, you know, practices can create their own videos, couldn't they, of how to do this, to put it on their Facebook, on their Instagram, TV. You know, they can get all this content together and put that out there on their social media channels, because it would be a really different message, I feel. You know, we want to teach you how to do this. It's a very different message that I don't think many patients would have heard unless they're yours.
I mean, I do absolutely agree with you. That is a really powerful way of getting the message across. And I mean, hopefully there are 2 or 3 people out there watching us right now, because people do tend to watch social media. I think the issue for many practices would be to find out how you actually do that. You know, maybe you've got some advice on actually the mechanics of doing it.
Yeah, absolutely. So I think the first thing is the person who's going to film the video needs to be quite confident in what they're doing. So if you're, you know, addressing the camera, you need to make sure that you're going to stick to the point, to the method. You're not going to deviate off. And as much as there's important areas to cover, I mean, everything would need to be covered, you've got to make sure that it's as short as possible, the video as well. That would be my other tip. You don't need to have a banner or anything like I've got, just be in the practice. And you can film it on an iPhone or any other phone and just film it in landscape. And it's brilliant. So don't film it this way, you film it in landscape, and it will film a lovely HD video for you that you can then use in many other ways. And I know we're on social media and we're talking about social media, but not every practice uses their social media. They don't have the reach, they don't have the growth. So they can start looking at newsletters. You know, patients don't have to sign up GDPR and opt in to receive an educational video on self-screening. They don't need to sign up and opt in for that. You can send that to everyone who's got an email address within your system. So there are many different ways. You can look at, you know, sending the link out to the Mouth Cancer Foundation to download the leaflet. And I think one of the other things that practices used to do a lot, which I've always found was really successful, and it's successful for two reasons, and that's having a mouth cancer screening open day. Now, obviously, the chances of that happening this year are pretty slim. So you need to be innovative. You need to think of, how am I going to do this now? So could you invite your patients to join you on Zoom, for example? So they can come onto Zoom, and as a clinician, you can explain the self-screen. You can explain what you do. And, you know, if you weren't aware, this is definitely what we do. Every time you see the dentist, every time you see the hygiene therapist, you have a full mouth cancer screening. And it covers 8 areas, 10 areas, however you categorize it. And then you can explain to the patient that you're now going to encourage them to self-screen, and you're going to talk them through how to do that. You could do it as a live, just like we are now. At the beginning of this, I said how many people always watch the live event after the event. So what happens there, and what that really means is, if you do a video live, well, it's a little bit different. You can invite your patients to watch it. You can invite new patients to watch it, not watch it. But also it will sit on your Facebook page and people will watch it again later. You can boost that post. So there's many different ways now of creating awareness, and it's time to think out the box rather than just saying, oh dear, what a shame, we were going to do a screening event and we can't now. Think of different ways, because this is different and actually it is positive, and I think that's what we want to be putting across to patients. I've got a question for you, Philip. How often do you recommend that patients do self-screen for mouth cancer?
Oh, every month at least. And I mean, you know, I say every couple of weeks, because it takes no time.
No.
You know, once you've done it the first time, you've got a rough idea of what you're doing. It's really quick and easy. And another thing that I would say about self-screening, you know what, if you want to make it really easy, get somebody else to do it for you. Because if you've got a partner or somebody in your support bubble who is available, it is a whole lot easier. You can use a checklist of the areas that you're going to look at, and then just look around each other's mouths. But if you can't do that, all you need is a mirror and a light so that you can see what you're doing. And then the leaflet or the information on the Mouth Cancer Foundation and so on will tell you precisely which areas to look at and what you're looking for. Another thing, though, to say about self-screening is that most of us don't honestly peer down the back of our throats very often. And when we start doing this, we can see all sorts of things that look unusual to us. You know, even people with big tonsils are going to say, oh, what's that lump at the back of my throat?
Yeah.
Again, as a rule of thumb, if it's a natural structure, it's going to be on both sides. You'll see it mirrored more or less on the other side as well. If something's only on one side, then that makes it a bit more suspicious, but not particularly so. But we would say, if you're in any doubt at all, then get it checked out.
Yeah.
And again, you were just talking about using your mobile phone to take a video. Well, hey, it takes photos as well. And so again, open your mouth, point the thing into the right direction, take a photo, and send it through to your dentist. It's not that easy to take photos inside the mouth, but it's not impossible either. And during the lockdown, I got some really useful photos coming through from patients, which a picture's worth 1,000 words. It really helps. But the most important thing with self-screening is just do it. Find a way, one way or another, but just do it, and do it as frequently as you can.
Yeah. So it's not just patients that need to start doing this. We all need to start doing this ourselves.
You know what? Sadly, we are not immune from mouth cancer just because we've got a GDC number. And so, I'd like to think it was a perk, but it really isn't. Yeah, of course, we've got to examine ourselves as well. And I just want to pick up on a point you made a few minutes ago about taking the videos. You said, oh, the dentist can do it, or the hygienist can do it, or whatever. This is so important, because the early detection of mouth cancer really is a whole team effort. Everyone is involved. And I know you've come to one or two of my lectures, I always start by saying that it's not just for the dentist. It's not even just for the clinical team. It's for everyone in the practice. And certainly everyone should feel involved. And the more people who spread awareness, the better it is for everyone.
Yeah, absolutely. And we've got to lead by example, haven't we? It's the same as flossing. And we've got to lead by example. And if we can be saying to patients that, well, we do this, and you've got a story as well, haven't you? Yes, it felt a bit strange to do this to myself as well, first of all. But isn't that the way when we start screening ourselves as men and women? It's just something else to add to the checklist each month, isn't it?
Yeah, at first it seems strange, and then soon it becomes second nature, like any habit. You develop a habit, at first it's odd, but it doesn't take very long for you to become very, very comfortable with it, and just something you do.
I've just thought of something. Start up top, then work your way down.
Right, yes, I'm sure that could work. You'll have to write a paper on it.
If you're doing both your screenings each month, start at the top first, work your way down, especially you men. Now, if you see me looking over to the side, it's just I've got another screen here, so I'm just can see some comments that are coming up.
Okay.
So we've got some nice comments, great ideas, food for thought. It's important to get healthcare messages out there. Karen says she so agrees with telling the patient about checking for mouth cancer. Thank you for saying this. Karina said this is the reason because dentistry is undervalued, and we've got the lovely Chloe's put a comment on. Hello, Chloe. So if you've got any questions, please do pop them in. And I'm also going to put some links into the comments about the walk and about the Mouth Cancer Foundation, so you'll be able to refer back and click on those links there. Now, before we talk about Mouth Cancer Action Month in a little bit more detail, I did want to ask you, because it's something that I'm asked a lot by dentists, and it's about, the screening tools, the special lights that you can get. And I know the unique selling points behind them. I understand the technology and that they do increase detection rates, as I understand it. But what is the reality for practice owners? That's why I like to ask you these questions, because you're always honest. So what is the reality? Do practices need to invest in these tools or not?
Not.
Okay.
And it's the honest answer.
Right.
But I will qualify that, because I am a supporter of these things, and I think I've got all of them in the surgery here and there, for several reasons. Because first of all, it really demonstrates to your patient that something very important is happening when you pull out a bit of shiny kit. Yeah, people like to see technology, and it brings it home to them that this isn't perhaps what they've always been used to. It's a new and progressive technology. And secondly, as a dentist, I'm never happier than when I've got something in my hand fiddling with it. And it does concentrate your mind. And I suspect, and there is absolutely no study to support this, but I suspect that we might look a bit more carefully when we're tracking an area with a particular optical tool.
Right.
Now, having said that, the evidence that anything can be discovered with an adjunct that can't be seen with the naked eyes is poor. Every company that produces them will claim that this is so, but overall it is very, very difficult to substantiate. And still the most important thing in the dental practice as well as a home is a good light source, magnification. And remember, if you're using magnification, you really need a good light source, because prismatic loops work on an inverse square, you're losing light, everything looks dimmer. So you do need a good light source. The only tool you need is something to pull away the lips and the cheeks. The mouth mirror is pretty darn good for that, or your fingers would do. But the most important thing, of course, with that is when you're moving your fingers around your mouth or your mirror, for goodness sake, look at the area that was just covered with your finger. You can put your finger on top of an early cancer while you're pulling the cheek away, and then move on somewhere else and never notice that it was there. So we do have to be vigilant. So on adjuncts, I certainly wouldn't say they don't have a usefulness, but I'm not convinced that you absolutely need to have one in order to carry out an effective examination. And some of them are really quite cheap. I mean, anything with dental written on it is always very expensive, but these are on the cheaper end of expensive. Others are extremely costly. And that brings us on to a bit of an ethical dilemma, because some colleagues may say, well, how am I going to recover my investment in this? And there are all sorts of initiatives. They can say they're doing a full mouth health exam and maybe introduce some saliva diagnostics and various things and make a charge for it. Well, if your patients want to have these sort of extra services, that's fine. But in the Mouth Cancer Foundation, we absolutely stress that an examination should be carried out completely free of charge at least once a year, and more often than that if possible. And again, because it is such a quick procedure, and because 2 sets of eyes or 3 sets of eyes are better than one, the way we do it in our practice, I see a patient through an examination, I'll do a mouth cancer check, a hygienist will see them maybe in a few weeks, do another mouth cancer check, because between the two of us, there's less chance of actually missing anything. So the more people that are involved in this, the better.
Definitely. And I wholeheartedly recommend with any practice that I'm working with that the hygienist, therapist and dentist, every time there's an examination or an appointment for, I hate to say clean, a hygienist gum health appointment, that there is a full screening that takes place. So some patients could be having that 4 times a year, some patients could be having that 6 times a year. And that's great, isn't it? I'm really glad you sort of cleared that up, because I'm asked that question quite a lot. My response is usually that, well, one, it's an investment, which you need to think about. But for me, I think if the dentist or the hygienist therapist is really, delivering that experience, they're calling back to their nurse, the inside of the lips look healthy, the cheeks look healthy, and the patient's hearing this healthy, healthy, healthy. And then afterwards they're told, I've just completed a mouth cancer screening. You'll be pleased to know everything looks healthy. I think that builds so much value into the appointment and the clinician as well. The patient's listening, they're hearing, hopefully healthy, 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 multiple times. And I think that's a really good message for patients to get. So
that's great. Repetition really is everything in this sort of message.
Yes.
Another thing, I've just written an article for one of the dental magazines Other fine titles are available. But in that one, I'm talking about patients who are visiting specialists.
Oh,
So,
yeah.
for example, a patient may start a course of orthodontics and be seeing the orthodontist regularly. The orthodontist may assume that the regular dentist is doing a mouth cancer exam. But how do you know? Even if you're a specialist, it's only going to take you a minute or two. And you're adding value to every one of those appointments. I think that's something that all specialists who are seeing patients sort of over long term, periodontists, for example, should really be aware of and carry out an exam as well as expecting it's being done at the patient's own practice.
Yeah, that's a really good point. That would be great to read that article as well, Philip. That would be great.
Well, I'll let you know when it's out.
Let me know when it's out. We'll put up a PDF link to it.
Yeah.
Because it's such a valid point, isn't it? It really is a really valid point. Right, we're going to have to move on now. So we talked about social media. We've talked about how practices can start to engage patients. I'd just very quickly like to touch on something that happened to me almost 2 years ago, which is when I attended the launch of Mouth Cancer Action Month at the Houses of Parliament. And I went along on behalf of the Society of British Dental Nurses. I'm an ambassador for them, and I went along with their chair, Emma Riley. And we heard stories from, real life people. And one of those was a lovely lady called Rachel Parsons. And her story just struck me so much that day. And it's a special story, and you can follow her on Facebook, and she speaks about her story. I think her story is on the Mouth Cancer Foundation website as well, along with a few other people. But just to give you a quick overview about her, everybody, was that she was originally diagnosed with lichen planus, and she kept going back to her dentist, and in the end she went to a new dentist, and that's when she got the referral and then a diagnosis of mouth cancer. And she was so young as well, wasn't she, to have that diagnosis as such a young lady, really. She still is now. And her story really struck me. Is there anyone else that whose story that you've encountered with the Mouth Cancer Foundation that's really struck you, and how the Mouth Cancer Foundation has helped that patient, or is how they're now raising awareness with you?
Well, I mean, too many to want to single anyone out. But in fact, if you go onto our website, and I think it's in the About Us column, and look at our list of ambassadors, we've got clinical ambassadors, patient ambassadors, survivors, and so on. And the stories that are on there are really moving and show an enormous amount of courage, not only from the sufferer, but from everyone around them. And, if you think of somebody like Rachel, then think of her husband, Tim, as well, because he has had to go through this journey with her. And it's terribly hard. And this is why we always say mouth cancer doesn't only affect the sufferer, but it affects their families and friends. It can be life-changing. It can change the way that you live always after that. And so I think even in Rachel's story, she said it was really quite some time before she could eat normally again, that she'd had grafts, and her mouth was stiff, and she had to do a lot of physiotherapy exercises. And, you and me, we think, hey, why not go out for a meal this weekend? But if you're a mouth cancer survivor, that's not always possible. And if it ain't possible for you, it's not going to be for your partner either. And people tend to become quite withdrawn because they lose the social contact that they had before. We all know a thing or two now about losing social contact. It's terribly important to people. But that's one of the things that can happen. Now, fortunately, a number of survivors have become ambassadors for the foundation. And I don't know what the foundation has done for them, but they are doing fabulous work for the foundation through sharing their story, through spreading awareness, and through giving hope to anybody else who might have this disease.
Yeah, and that, I was just thought, then so much that goes on in life, we don't have time to register everything all the time. And just what you were saying then about, we take going out for a meal, just having a meal for granted. I remember, probably it was a couple of years ago, my best friend, her father had mouth cancer. And one of the side effects of that, he was told, was that he would most likely never be able to taste food again. And she was really upset one day because he was struggling with the chemotherapy. He'd had surgery on his tongue. And he said, do you know what? If I would rather live a shorter time and enjoy food than live a longer time and not. And that's where he was at that time. And it was devastating to hear that from your father. And he did change his mind, and he had the chemotherapy and he finished his course of treatment. But like you say, there's that such huge impact on everybody around you.
Oh yes, it's not only the person with the disease. Tell me something though, did his sense of taste come back?
Do you know what? I'm not sure, but I'm going to find out. I'm going to have to
ask. It often
does.
It can take a long time. It can take more than a year. Wow. But it often will come back, at least to some extent. And some people, unfortunately, no, you're right, it never comes back. But it's more usual that you will get something back in the course of time.
Yeah.
But again, it is all sorts of things like that. Yes, going out to a restaurant, that's a really easy one to use as an example. But just speaking in public, speaking to groups of friends or to other family members, if your mouth isn't working properly anymore, makes people very self-conscious. I mean, they shouldn't be, because disease is disease. Nobody should worry about it, but it does. And as I usually try and say, it's a disease that doesn't only change the life of the sufferer, but it has a massive impact on everyone around them.
Absolutely. I've got one question to ask you. Okay, so I remember when I started as a dental nurse all those years ago, Philip, back in the day.
Oh, I can see you're a really old lady now, aren't you?
I've got a Zimmer frame next to me.
Yeah, that's right.
So, which was over 20 years ago, my dentist who I first worked with, he said to me that when he was a student, so he's retired now, so we can put his age into context. So when he was a student, he was told he would see probably see one case of mouth cancer in his whole career. And I remember at that time, he said to me, he has detected 2 cases. And the reason he was telling me this is because later on that day, we had a patient coming in who, I can't remember the name of the appliance, but had lost half of the roof of his mouth. So he had the appliance in. So he was telling me in advance, to sort of preempt the situations, that I wouldn't be shocked by what I was going to see. What are students being told now about mouth cancer, whether they're studying as a dentist or a hygiene therapist? What are they being told about mouth cancer and how many cases they may come across in their career?
I don't think anybody will predict how many actual cases you may see, but things are quite different now. And in fact, the reason I think I became interested in this subject in the first place, I went to a lecture on oral medicine, like complainers and that sort of thing, in the 90s, the early 90s. And the lecturer pulled up a slide of mouth cancer. And I said, good, what's that? What's that? Oh, don't worry too much about that. You'll hardly ever see it. It's just something that specialists deal with. And I thought, well, I'm not sure about that. And I started to research it. And that's how I developed an interest in the disease and how I learned that early detection really is the key. When I started lecturing on early detection, which is around about 20 odd years ago, we were lucky if we got 5 people in the room. Yeah, BDA section meetings and this sort of thing. Hardly anyone was interested. And it was a long, hard slog. And then eventually, more attention was paid to the disease, with the result that the General Dental Council made it one of their recommended core subjects. The year before, I'd given a lecture to 35 people, which I thought was really good. On the year it became a core subject, I gave a lecture in, I think it was in Olympia, 1,500 people in the audience. So again, you know, I won't hear a word against the GDC. That's what they did for mouth cancer. But it is true that for the past, well, for a number of years now, there has been a huge increase in awareness among educators as well as among the profession. And in universities now, there are certainly, there's quite comprehensive education, which goes along with oral medicine education.
Yes, and I think, you know, that was a long time coming. Were you heavily involved in that with the GDC, sort of, you know, to get it as a core subject?
No, strangely, I keep away from that bit of Wimpole Street.
Really? You're not a fan of Wimpole Street?
But no, I wasn't actually. I'd like to say I was involved with that, but I mean, I'm hoping that my efforts, or people like me who at the time were trying to bring this disease to the forefront of people's thinking, might have had something to do with influencing the decision that they made.
I'd imagine it would have, definitely. Okay, so let's talk about the walk then, because I'm just conscious of time.
Yeah.
So can you first of all tell us about the history of the walk, and then we'll talk about how it's changing this year? Is that okay?
Yeah, I mean, the walk began at the dawn of time. I remember in those early days, the trouble we used to have in Hyde Park with the pterodactyl swooping down to steal our ribbons. And actually, that's when I started the 10K walk. I'm a bit of a slow walker, but I'm hoping this year I'll complete it.
You will.
Okay, so the walk has been around now for quite a while, and it is a fabulous event. It's always traditionally been held in Hyde Park. We get lots and lots of people there. We celebrate our survivors. We make new friends. We raise awareness. We generally just have a really good time. Now, sadly, this year, for obvious reasons, it can't go ahead in its normal format. So, again, thinking a bit outside the box, we've made it bigger and better. And anyone can do it now, even in the comfort of their own home if they want to. You know, you've got a long enough garden, just keep walking around it and you'll make the 10K. All that we're asking really is for people to record where they've been, the route they took, so that we know roughly it's the right length, and send us some selfies, photos, videos, if they got anything at all. And I think it says on our website as well, we want people to walk it, but if they'd rather hop it or go backwards or whatever, that's fine too. The important thing is take part, get a bit of sponsorship, raise awareness of mouth cancer, and help the foundation at the same time. And the foundation will do everything we can to help you organise things.
So I've just put the link onto the comments for the walk. And I love walking, okay? I really do. I have, for one reason or another, never actually been able to attend the walk. So for me, when I heard about how it's going to be this year, I was really excited about it because I know I can get involved. And the other thing, you know, you don't have to do it you don't have to go for a 10K walk on one day. So 10K is 6 miles. You can do a mile a day for, you know, you can do a mile, you know, every 4 days. You can break it down because you've got a huge period of time actually.
2 months, got 2 months to do it.
Yeah. So, and now I'm quite competitive. So for me, I think, oh, this is really good. I'm really going to be able to enjoy walking because it's actually autumn. So in the autumn and the spring, you know, you get to really get out there and enjoy it a little bit more. I think it's really good for your mind to be out walking as well. That's one of the reasons I enjoy it so much. And I like to switch off when I walk. I used to always walk with headphones in, but the very last lecture I was at before lockdown, I heard a lady speaking about mindfulness, and she was saying about just when you're out walking, just listen to the sounds, take it all in. I've been doing it ever since, and it's great. So it's also something you can do with friends at a distance. But again, if we go back to what a practice is posting, they're posting, don't worry, it's okay, we're used to PPE, we've got advanced PPE now, we're not charging you for PPE, we are charging you for PPE. We've got lots of things about PPE. Thankfully, patients know about it now, that's great. But isn't this an opportunity for 2 months? Every week you can be posting different pictures of different team members that are out walking and doing the walk. So it's going to raise awareness, it's going to raise the profile of the practice. And everyone loves photographs that, you know, with Instagram, so many hashtags that you can use. So for me, I feel it's something that straight away I wanted to be involved in. I have ordered a t-shirt as well. Okay. You don't have to, by the way, everybody, but I have.
I think that is a really brilliant idea, and it is certainly something that any practice can do. Yeah. And like you said, it doesn't have to be in one 10-kilometre bite. You can do it in as small sections as you want to. And of course, you don't even have to only do it once. I mean, you said walking is good for your physical and your emotional well-being. So why not do it more than once?
Yeah.
And get as many people involved with this as you can.
Yes, so whether you like walking or not. So if you're at the end of the scale where you think, oh gosh, I really don't like walking, but I'd like to do this, aim for doing the 10K over that 2-month period. If you're a bit competitive like myself and you like to walk, well, let's have a competition. How many times can we do the 10K in that period of time? That would be fun. And also, when you register for the walk, you can join as a team as well. So you could have teams. So especially people that are in practices where there's multiple sites, you could have teams and you could all compete with each other to see which practice team is doing the most kilometres. I nearly said miles because I'm used to miles, but who's doing the most kilometres? And I just think it's something, you know, really great to be involved in. And, you know, if you do know patients of your practice that are mouth cancer survivors, perhaps do reach out to them and get involved. Ask if they'd like to get involved. Would they like to go on a socially distanced walk, or would they like to send photos for you to put onto your page? But I think the key thing is, if you are going to use social media for this, definitely keep tagging the Mouth Cancer Foundation into every post, because then they can just keep reposting and reposting. Yeah, and I think that's really important. So if you're using, whether you're using the hashtags or not, just keep tagging the Mouth Cancer Foundation, because the more that we can see that, the better. Hashtags are really important. If we can get, you know, some things trending, that would be great as well. And of course, on Instagram, you can follow hashtags. That's something that I absolutely love, is to follow a hashtag. So just thinking of one of my latest ones. It's about paint.
To me now. Instagram and hashtags. I know what I'm sitting in front of is a computer, but that's about as far as it goes. But
you make me laugh. Oh, Philip, you are great, I have to say. I knew this would be fun with you.
Well, we're enjoying it.
Yeah, it's honestly been fantastic. So is there anything else that you think would be valuable for us to discuss right now before we finish up? Anything that perhaps I haven't asked you that's really important?
I think we've really covered more or less what you had laid out at the outset. You know, this is not the time to give a lecture on signs and symptoms and risk factors and so on, because these are all things that people will probably already know, and if they don't, they can easily find out. I think this is more about emotion than science. You know, what I mean is that I want people to become passionate about doing can save so much misery and suffering with actually very little effort from themselves. But the key to that it's awareness and actually getting out there and doing something.
Absolutely. So let's do it, everyone. Come on.
Have there been any questions?
We haven't got any questions, but what we have got, Lady Karen has said, I have so many friends taking part in this year's walk. It's going to be great, with a blue heart, all in their walking bubbles.
Yeah.
And Karen's also put, so I don't know, I think you might know this lady. She so agrees about eating out after mouth cancer. Thank you, Dr. Lewis, she's put here. So we might get some more comments afterwards. We'll see. But I think the key thing is for everybody to follow the links, go to the Mouth Cancer Foundation website. I've also put a link on for the walk. That's separate. That's where you can register. You don't, as I said, you don't have to buy a t-shirt. It's just that I want one.
And anywhere at all you want to. You don't have to come to Hyde Park anymore.
No, you don't have to go to Hyde Park. You can even do a Captain Tom Moore and do laps of your garden, can't you? You know, we can get our children involved as well, which I think is always a nice thing to do. And, you know, what's greater than being out in the fresh air, breathing in and taking it all in and enjoying life, while at the same time creating awareness. So the two things are really the walk, so we can really start to create some awareness, get everyone involved in that, and really take the opportunities to have a think about the self-screening. Start doing this yourself, get the leaflet, and then have a discussion in practice about how you can get patients involved in self-screening. It's absolutely vital, more than ever right now, And myself and Dr. Lewis have obviously been a huge fan of this approach for a long time. However, it's so important right now, isn't it, that patients are aware of what they need to do while they're perhaps unable to access the dentist. And then it's the reassurance to them that if they have a concern, they will be seen urgently, and that will happen. So, Philip, thank you so much for your time tonight. I really do appreciate it.
Well, thank you for inviting me.
No, thank you. You've been absolutely great, as always. And yeah, I'll speak to you very soon, I'm sure.
Thank you.
Thank you for everybody who's joined us. Thank you so much. Okay, I think that's stopped.
Yeah, well.